meeting for the statewide CDSMP collaborative. Today is September 3rd, and this meeting is being recorded, and you can view it again on the website of selfmanagementcolorado.org. And I wanted to, we're going to start this meeting a little bit different because I've invited a guest. I had this sort of last-minute thought in addition to our agenda, which I thought might be helpful to all of us. So I've invited a guest, which is Jenny Bartles. And let me click on these slides here. You'll see that we're going to share about best practice. And I thought she is from MCPN here in the Denver area. And I'm going to prompt some questions to her and have her answer those so that we can hear how they've embedded this program successfully into their health system, and thought that might be of good information. But she has to come and go pretty quickly, so I'm going to start with that, and then we'll go into Kelly's data entry updates, Connie's report on the current grant. Telligent has an update on the diabetes self-management reimbursement. We do want to talk again about name discussion of our CDSMP classes, and then, as always, review statewide trainings and next agenda items, which you'll see a later slide that will have a little more on that. So I'm going to hurry this along, but what I would like to do in a roll call manner is have everyone introduce themselves so that Jenny knows who is on the call. So if you'll say your name and what organization you are representing, what license holder you are, that would probably be helpful to her. So I'm going to do it based on the list I have in front of me. So let's start with Glenda Mitchell.
Glenda Mitchell, Center for African American Health, Diabetes Self-Management Program.
Great, thank you. Maria?
Maria Lopez, the Director of Health Promotions at Clinica Tepeyac.
Thank you. Kelly McCracken.
Hi, Kelly McCracken with chronic disease at the Colorado Department of Public Health and Environment.
Thank you. Connie Young.
Yep. Yes, I'm with State of Colorado Department of Human Services, State Unit on Aging.
Okay. Meredith?
Good morning. This is Meredith Koob. I am with Telligent, who's the state healthcare quality improvement organization contracted with Medicare, and specifically the Everybody with Diabetes Counts initiative.
That's a long title. And then, of course, this is Mary Pat Gallus with Consortium for Older Adult Wellness, and chairing the collaborative this year. And then also I have with me another staff person.
Kelly Jackson. I'm a program coordinator with COA.
And Kelly is now taking minutes for us as in lieu of Cheryl. So we've kind of reorganized our staff assignments. So Kelly, welcome.
Thank you.
And she's very familiar with Jenny. So Jenny, I'm going to start with you. And my first question to you, Jenny, is just if you would introduce yourself, the agency you work for, and sort of just a quick synopsis of what MCPN does.
Sure. My name is Jenny Bartles, and I work as the Diabetes and Health Education Program Manager for MCPN. And MCPN is its Metro Community Provider Network, and we provide healthcare services for the underserved in the Denver Metro. So we cover what we call is the horseshoe of Denver. It's kind of the outside of Denver. So it's Arvada, on the west side, Arvada, Lakewood, Englewood, South Aurora, and North Aurora, kind of in that area. And we have 23 clinics within our system. And so my role within the organization is I work in managing the diabetes and health education program for our system.
All right, thank you. And you do it system-wide for all those clinics?
Yes. Yes.
Okay, good job.
System-wide.
So tell us, Jenny, why and kind of how, when you guys got started with self-management program, specifically the Stanford model.
Well, I think that COA actually reached out to us initially. And so we've been partnering with COA to implement the chronic disease self-management. I think it's about 4 or 5 years. And so we started off really with the program in attending the training sessions on some of the staff members. And as we've grown through the years, we've had more staff members who are trained in implementing the chronic disease self-management classes. And we actually, we're kind of unique in that we primarily implement the Tomando control, which is the Spanish version of the chronic disease self-management program. And we've just found that our instructors are trained in Tomando control, and we find there's a definite need in the community for patients to have that resource.
Great. So you've sort of segued into my next question for you, which is which ones your agency leads. So if I'm not mistaken, you have staff trained in the English, the regular chronic disease self-management, and obviously in the Tomando control, as well as the diabetes versions of both. Is that correct?
Yes, yes. So we have 4 bilingual health educators who have been trained in the Tomando control and Tomando control diabetes, and as well as we have 2 health educators who have been trained on the English version of the chronic disease self-management program. And so we recently offered Tomando control classes at 2 of our sites over the summer. And so we've been really excited about, just being able to, we have an additional staff member who is providing the classes. So we're able to expand the classes that we offer, which we're really excited about.
Okay. So you mentioned health educators. Are these a full-time staff with MCPN that are leading the classes?
Yes. Yes, they are full-time staff. And one way that we implement the classes is the classes are generally part of their work hours. And so it's just part of their work day. And it's primarily our educators who recruit patients for the classes. And they often recruit patients from their caseload. So they identify patients as they see them for individual visits and identify patients who might be interested in taking the classes. We do market the classes to providers and other clinic staff, but we have found that having a personal invitation from the health educator really has been helpful for enrolling patients in the classes.
Okay, great. And so I'm thinking they have this relationship established to also encourage them to come to a class, and they're going to know maybe one of the leaders.
Yes. Yes. So each of us, when we're seeing patients, we identify people who seem to be struggling with managing their chronic conditions, and we keep sort of a running list of patients who have expressed an interest. They are reaching out. They would like more support, and in addition, we're just trying to see who would be probably a good candidate for the class. So we have a running list for our classes, which we found that very helpful, because then when we're ready to offer the classes, we have a list of patients that we already know.
Okay. How is the cost of this sustained? I know that's an important question by this audience. How are you guys sustaining the cost for this program?
Part of our sustainability is actually through grants that are offered through COA, or when there's times when COA does have funding for reimbursement for participants that complete the class series. And then what we do is we use that money to then purchase books, purchase materials, CDs for the next, for future class series. And so it actually goes, it really has been pretty substantial for us in being able to continue implementing the classes. So we use that stipend.
And then, of course, MCPN is absorbing the cost of the leaders and their time and the facility and that sort of thing.
Yes.
Do you guys subsidize a snack cost too?
Yes.
Yeah, I thought you guys picked that up too. So my last question for you, and then if there are any more from the group, what would you tell license holders, folks like myself on the phone, how to best message these Stanford classes to staff that are in these health systems? You know, what's the hook? What do you think is what your side of the services want to hear? What makes them want to do it?
I think a couple things. I do think, you know, one thing I really appreciate with COA is that you really work with us, or that the health center, to meet our needs and to be flexible. And so it's just been so easy to work with you, because I do feel like you acknowledge or recognize some of the challenges we have in a busy community clinic, and kind of work with us to help resolve some of the challenges, you know, just in marketing. So I think a lot of it is identifying someone in the clinic who can be a champion, and working with that individual in a very supportive way. I do think another huge plus, I think, for the group is the feedback loop to the clinic. So when patients, let's say they're taking a chronic disease self-management class outside of the clinic system, I think the staff at the clinic really enjoy hearing kind of how the patients are doing with the class. And so I do think the letter that's at the end of the class is a very helpful feedback loop for, you know, for the staff. But I think, and I also like how COA has you make referrals easy, and that we're able to fax referrals over as well for our patients. So those are a few things that we found especially helpful.
Okay. I know, Jenny, you just have a couple more minutes, but I wanted to open it up to anyone else. If anyone has any other questions or thoughts or ideas for Jenny.
And this is Connie. Jenny, I was wondering about when Mary Pat was asking about the messaging, what do you find useful in terms of your patients and their experience with this, their outcomes, that sort of thing?
For as far as kind of for marketing purposes, or for?
Well, yeah, I mean, and just, you know, I assume that you do this because it's beneficial to patients, but that's what I was wondering about, if you do, and if so, what do you find that's helpful about the program, and why should people do it for their patients?
Well, we found a lot of patients, what we recently have found is our patients, often we'll see our patients perhaps we have a diabetes clinic, and so we may see the patients in the diabetes clinic setting, and we've had patients comment to their providers and to us on how much the group support has helped, and how the specific changes that they're making to improve their health. Or I'll just give an example. There's a patient who's really engaged in our Tamanda diabetes class, and we saw her in a diabetes clinic, and she just commented on how she used to be afraid to test her blood sugar numbers, but now, you know, she recognizes that there's other people that have the same challenge, and she, you know, doesn't need to feel afraid. And so, and her A1C is also going down because she's feeling more empowered. So we do see definite changes in confidence, you know, that patients are able to manage their chronic condition, and they're more able to talk with their provider about what they need. And because a lot of times, you know, patients are in more of a passive role, and just help put the patients in more kind of being in the driver's seat of taking care of their health.
Okay, great. Thank you.
Sure.
Anyone else? Well, all right then. Thank you so much. Go ahead.
No, I was just going to ask, I'm curious, are your clinics and providers, are they participating in any quality reporting programs where you're evaluating or looking at the effect on clinical outcomes? I'm wondering if that's part of how you get support from the providers on this.
Yes, certainly, especially for the Tamando controlled diabetes classes that we offer. We definitely look at improvements in the patient's A1C levels, as well as BMI. We are looking at just for future classes to also assess the patient's confidence level in self-care. And so we're looking to identify a survey that we could use to measure that. But right now it's mostly clinical measures for A1C and BMI.
Great, thank you.
Sure.
Well, all right. In respect of Jenny's time, I'm going to finish this and close on this. But Jenny, thank you so much for sharing. I would love to see this become like a regular agenda item and let all the license holders invite one of their partners and that they're having success with, so we can certainly learn from each other's best practices. So thank you for being our pilot on this.
Oh, absolutely. It's my pleasure.
All right.
Hey, this is Linda Mitchell. Could I ask one question? Is it possible to get your contact information? I'm particularly interested in the A1C types of screenings and things that you provide.
Sure, absolutely.
For the public?
Sure.
Okay.
I could certainly send my contact to Mary Pat has some of my contact information. And so
right, and I could send that out to the collaborative. Will do.
Absolutely.
All right. All right. Thanks, Jenny. Have a great day.
Oh, thank you. You too.
All right. Bye-bye.
Thanks, Jenny.
All right. Thank you all. Hopefully that you found that as some informative information. Like I said, I would love to see this perhaps be a, maybe a normal part of our agenda every month and take about 15 minutes to hear from our partners. I think that's a great learning tool. So next on our agenda is Kelly McCracken and any updates that she might have.
Hey, everybody. Thanks so much. And thanks, Mary Pat and COA. I thought that was great. It was wonderful to hear from folks who are doing this work and how that is working within their system, because I think there's so much crossover here for us to think about with other evidence-based programming like the diabetes prevention program or diabetes self-management education. So while this is focused on the Stanford program, there's no reason not to think about this at a systems level for those other programs as well. So thanks. I think that was great.
Good.
So I don't, just like always, I'm here on the agenda to take any questions or feedback about data. I think that there's going to be some conversation with the announcement from Connie that they didn't receive the grant for the following few years, and I know Connie's going to be talking about that. But what the collaborative wants to do in regards to this data that is coming to CDPHE. So I think Connie and I are going to start that conversation on Friday, and then we'll talk about how we bring that back to the collaborative for the conversation to continue. And I'm really interested to find out kind of what the value is for the state to continue to play that role in data collection for CDSMP data. So more to come on that. But in the meantime, we will continue as we have been. So I know the current grant is probably still finishing out in classes that you all have continued to offer and are going to be asking for reimbursement for. So just keep sending that data and we'll keep entering it. And are there any questions or concerns that folks have for me? All right. Well, that's all I have, unless there are any questions or anything I can do for anybody.
All right. Thank you, Kelly.
Yeah, no problem. And I'll stay on the call, so if anything comes up, okay. I'm here.
You might want to give a little plug about your guest speaker that is confirmed for the November meeting while we've got you on the line.
Oh, sure. Yep. So we've all been talking about this, and folks gave their good feedback about what they would like. Renee Callanan, who's our epidemiologist, chronic disease epidemiologist here at CDPHE. She's actually in the service corps for the CDC, the Public Health Service Corps. So she is kind of on loan, I suppose, from CDC to CDPHE. She's really an amazing scientist, wonderful epidemiologist, has done a lot of work in analyzing data on chronic disease trends in Colorado, and so she's going to speak in November just about what everyone kind of decided was a good thing for her to talk about, which is adults 18 and older and what those chronic disease trends are, specifically looking at geography and burden of those diseases in different areas of our state. But again, she's expanded that age not just for 60 plus, but for 18 and over. So we'll look forward to that, and she'll give a brief presentation and then leave time for questions as well.
Great, looking forward to that. All right, I think then we will move on to our next agenda item, which is Connie sharing about this current grant and any other next steps or et cetera, et cetera.
Okay, thanks, Mary Pat. I actually just got an email this morning that our extension request has been approved, and that is basically because quite a few things were not completed by August 31st, so this is giving us permission to complete them in the coming year. So I don't have the request in front of me, but basically there were things like COA completing its embedding of CDSMP in some the committed number of clinics, and the training that COA and I and some local folks are going to do with, it's not really training, but presentations about CDSMP to local organizations, and we talked about Montrose and Alamosa to educate people about why they should get involved, and at this point a part of that will be why they should pay for it, because grant funds aren't forever, whether they're in federal grant funds are over for us, and who knows what would happen with the funding that COA has through grants, which we hope that they'd be able to have funding indefinitely through sources like that. But the plan is to try to find ways to sustain this long term, both locally and on a state level. And then let's see, I had money in there for training, leader training and master trainer training that was not all used this past year, so I'll be querying all of you to see what's needed in this coming year, and if there isn't as much of an interest as I had anticipated, then we'll see if we can shift a small amount of funding around in the budget. There's money for a webinar that I'm working on now with Telligent, which is a peer-to-peer webinar, basically with some physicians making presentations about why they are committed to this program and like it for their practices and patients. And the presentation will be for other doctors. And our goal is to, of course, try to get other physicians to embrace the program and embed it in their own clinics and practices. So we're hoping to do that in October. few other things that I don't have at the tip of my tongue right now because I don't have that budget open. But basically, the positive thing is that we have gotten approval to complete what we had already started and committed to, so that's good news. Any questions on that before I go on?
Did you mention, you said a year, is it a year from September to next August that is the time frame on the extension?
In a way, yes, that is
okay.
That is the deadline. However, in my request, I outlined specific timelines for everything so that we wouldn't be asking for everything to drag on for an entire 12 months. We don't need that. And so I want to, I'll work with you all on what those time frames are so that we can stick to those.
Okay.
Connie, this is Kelly. I just, and I apologize if you said this and I missed it, but will there also be an extension for organizations getting paid for completers, or is that not part of the extension?
It was not part of the extension, but as I mentioned, if there's funding in other categories that we will not be using, we have some guidance that we can make up to 5% adjustments in categories, so there is that possibility. I don't have the answer to that right now, though.
Thank you.
Hi, Connie. This is Monica.
Hi, Monica.
Can you hear me? Hi.
I can, yes. Thank you.
Okay. I was just wondering if there's ever a possibility to do a master training online through Stanford. Would there be any funding for that? Instead of going out.
Yeah, I don't know that they do the overall master trainer training online. I know they do some cross training, but yes, online. I mean, if there is either cross training, we have funded some of that already for people, and I definitely can support that this next year. Let me see if I can find that while I'm multitasking here to see if they offer online CDS or the overall master trainer training. But one thing I also found out is that on a space available basis, they will accept people into the master trainer, at least cross training, to become leaders of workshops, but be participating in the master trainer training online, and that would be, as I said, on a space available basis. For basically, if they don't have enough people who are available to take the training and want the master trainer training, we could get some of our prospective leaders in that. So that's a little riskier than some of the group training because, as we all know and unfortunately experience, sometimes people are trained, they never do anything with that, and that's not something we want to take a lot of risks with, but there is that possibility. So it would be master trainer training, potentially leader training, and cross training. I mean, I'm not saying specifically for Stanford on those three categories, but those would be things that we could fund with the grant funding, and that was the intention initially. So.
All right. Thank you, Connie.
Sure. Okay, so as I'm trying to pull this, sorry if I'll try to pull that up at the same time, but okay, then just to give you an update on the sustainability report for Maryland nonprofits. I know I've said a couple times that this will be finalized, and it will be, but not today. And the reason is that as it went through review here internally, one of the managers pointed out some things that were kind of missing in the report, and so and I actually agree with that. So we're going to look at how to address those issues, and we'll be working with internally as well as with Maryland nonprofits to identify some things and include some information that was not in the report, and also clarify some of the recommendations were made that pertain to other state agencies. So rather than put that out there, we want to give them a chance to say, yes, this is what we said and this is what is a possibility, so that we don't set somebody up to say, well, that's not even accurate, or, you know, that's not feasible, that kind of thing. So anyway, it'll be a better report as a result of that, but it's not ready yet.
Is that part of the extension request too then, Connie, that can be carried over and extended into the next few months or whatever is needed? Is that right?
Yeah, because we haven't paid the final invoice for that. So we would be able to do that, yes. Let's see, and as part of that too, I'll be talking with Kelly about how we can, if and how we can team up to approach some of the sustainability goals that we have. In talking with Kelly and when I was writing the grant, I was very impressed with the success that they have had with doing that very thing with some of the programs they run and getting financial support for similar kinds of programs. So they've done a lot of exactly what we would like to do with CDSMP. So I'm hoping we can talk about that, but we need to touch base first, and then, but I'll also be touching base with AHEC and COA, and then opening it up to the collaborative too on what role everyone wants to play in that process. I like the idea Mary Pat had of having, I believe you said you were thinking about having someone on each call, or at least as often as possible, with examples of how they've embedded CDSMP. And COA has also been really successful in getting a wide variety of people and organizations who have supported and are supporting the program with some degree of financial commitment. So that will be, I think that's a great idea. That's, you know, really our big push now, from my perspective, right, how to keep things going long term. And as a part of that, we had talked last time about kind of how to have the National Council on Aging, also known as NCOA, provide some technical assistance to all of us on sustainability. So I did talk with them about being on one of our calls, which is scheduled for the October call, about how other states are, some of the key strategies and successful strategies that other states have used to sustain the program. So they're going to put together a presentation for our next call, as I said, and it'll be, we'd like to carve out a total of about 45 minutes for that, because I think it'll be very useful. And part of what they're going to look at is this survey all the states recently had to do. It's an annual survey that looks at all the things that we're doing to keep the program going. So that will be part of their database to make a presentation to us. But I think that'll be a great start, or not just a start, but a great overview of the options, some of which have been covered in the sustainability research that Maryland nonprofits did. But this is from a federal, national level. So, and then I just, every time I've dealt with NCOA, they're excellent. They have lots of information. They're very responsive and very committed to helping us. So I'm excited about that. You know, if anyone has any questions that they might be able to address, you could send those to me, and I could see what they could work in. There may not be time for a lot of individual questions, but I can certainly propose those to them. And they also said that they are more than willing to take questions after the conference call and respond to email follow-up questions. So, and let's see. Oh, I already said that. Sorry, I'm looking at my list here. I think I've covered everything. Are there any questions about any of the above?
So this is Mary Pat. Just assuming then, as far as our wrap up with year 3 that ended on Monday, August 31st, are we in good shape other than the extension? Is that correct? Is there anything else hanging out there, or are we in a pretty good place for that? Just in case we need to do a shout out or anything.
In terms of things that would not be supported, you mean, finance?
Yeah, was there, as far as closing out what we do have and know for the end of August, are you in good shape, and other than what you've projected for the extension? Just wanting to be sure was there anything else needed to do or say or whatever for the end of August timeline?
Yeah, we need to get invoices in as soon as possible, but no later than the end of September.
Okay.
So we can close out the books and you know, or ACL, I have to look and see when my next report is due, but they often ask for an accounting of those funds by the time the report is done, which makes it tricky for us if the report is due September 30th and we're closing the books September 30th. But so I would say get them in as soon as possible, and then I need to take a look and see what those time frames are and see if I need to ask for.
Is it better to wrap up any invoicing that folks might have? Okay. Yeah. It's a good reminder, and so really more like mid-September would be ideal.
Yeah, and our accounting people have to do the final statement, so I don't know how long that takes, but I would say it'd be best to have that by mid-September, and I can always see if ACL would give us an extension on that piece of it, but it'd be better to get it sooner than later, and shooting for mid-September would be good, and that applies to everything. So some of the people who need to invoice me are not on the call, but if there's any travel expenses that are still unbilled, and then of course your invoices to us, Mary Pat and AHEC, and I'm trying to think what else. But anyway, yeah, that's the status of that. But there's no problem with paying for what's been done in year 3 as of August 31st. We just need to have the invoices in time.
Okay, good. Good. Connie, do you want to talk now or later about any next steps? We all got your email. Is that something we want to talk any more about, or
about where we're going from here?
Yeah, because up to now, of course, it's all been with that contingency, waiting to hear, and really sorry to hear that didn't come through. But what do you see as next steps as far as SUA's involvement, the collaborative? What do you think? Or is it just we're going to work on extensions?
Yeah. Well, on the extension part, as I mentioned, that there's a little bit of flexibility in how we spend the funding. So I need to query everybody about their training needs, because that's one category that I had funding and that hasn't been all spent, and I'm thinking probably won't be, and make some adjustments as appropriate with that, and then I'll look at other categories to see if there's other input that I need in order to make sure that we're using all the funds appropriately, and hopefully using all of them that we had in our original budget. As far as the work to sustain the program, I have gotten the approval to be involved in that, not to the extent in terms of timing that I have been with the grant, because I'll be taking on other responsibilities. It's part of my job, but that's important to SUA, and we've had this grant for 3 years, and we don't want to, we want to support the effort that the funding that we have gotten has been a lot of, there's been a lot of, guidance and support for looking at ways of keeping the program going without those funds. So, we want to make good on that effort, and the SUA understands the importance of the program. And so, anyway, I will be able to be involved in that, and then I'd like to talk with Kelly, COA, AHEC, and then open it up to the other collaborative members on who wants to be involved and to what extent. And then strategies for actually going after those funds would depend on a variety of things, basically on our strategy, our priorities here, and what we think would, I'd like to look at what could be successful with the least amount of effort, just as try to jumpstart that process. And so I hope that NCOA's discussion will be part of that, and when we get the sustainability report, will be part of that. And then, oh, I'm glad you asked that, because then it triggers, it reminds me of one part of that that you and I discussed, Mary Pat, which is to bring people together for an in-person meeting, hopefully this fall sometime, and regroup about that and look at where we go from here. I would be having some initial discussions with the organizations I just mentioned, AHEC, COA, and CPHE before that, so we have some information about their involvement. And then kind of put together a plan based on that, those discussions. And we also talked about having COA do maybe a half day of that full day meeting to do some presentations and training about how they have succeeded in doing outreach and persuasion with other organizations, clinics. They worked with Lakewood State Wellness, well, I'm not state, but Lakewood Wellness Program, is that right? Anyway, with Lakewood and others to embed the program. I know that University of Colorado North, when Susan Milligan was involved, was successful as well in some of those areas. So to continue this idea of giving all of the collaborative members some additional resources and strategies for what they can do at their levels to reach out to potential funding sources, and kind of take COA's lead and run with that locally. So that was another resource that Mary Pat and I talked about. So we're hoping that that would be part of that in-person meeting.
Cool. Any questions anyone has for Connie on those topics?
I just want to say I know how hard Connie worked on that grant application and how many hours she put in toward it. And so I just want to say thank you, Connie. And I can imagine how disappointed you are and how disappointed, we all are. But I just want to say that, you did yeoman's work pulling that all together. So thank you very much.
Well, you kind of wonder if, I mean, I wouldn't have felt okay any other way of trying to, I mean, I did put in time on it, you're right, Kelly, and, the reason for that was to try to make the proposal as comprehensive and persuasive as possible, but I was never super optimistic just based on the things I mentioned in the email with cutting the number of grants by more than half, which is, legitimate for 2 more years, and opening it up to all kinds of entities, not just states. So the competition was much more fierce, and, we couldn't, I think we did put together a good proposal. Had that been 3 years ago, I think we would have been funded just as we were this time, but, we gave it our best shot, and, I think some of that information will be useful to us in our efforts now. And again, we are, the State Unit on Aging is not going to abandon ship on this. We want to do as much as we can to find ways of keeping this going through health plans, perhaps through Medicaid, perhaps through retirement programs, through employee wellness programs. So we'll be looking at all of that, and hopefully with all your help we'll be able to be successful.
Yes, thanks, Kelly, for acknowledging her efforts. Yeah, that's not an easy task. All of us who've been involved with writing grants and the time and the hours, and then when you get that return, it's a little bit deflating, but it's not for lack of trying, that's for sure. So
no, and
acknowledgement there.
Yeah, I think the most important part of that for me, and what I wish we could have really asked for just funding for this, if that would have, is the sustainability effort. But the criteria were pretty high levels of funding of 500 to 900,000 total. So we put together a proposal that was in that range because that was part of the criteria. But if I'd been able to ask for a smaller amount, it would have been nice to just fund the sustainability effort. But anyway, like I said, that wasn't what they were looking at. And I understand they want to get new startups that have the potential for expanding what's been done over the past 3 years. So it makes perfect sense from their perspective. And I'm hoping that we'll all be able to see the benefit of working together even without that additional funding to make to provide those resources that'll keep things going. Otherwise, it's it's going to have the grant would really have a limited impact long term, which I think would be unfortunate. So on the plus side, I think there's a lot of interest in committing to this. We've got the sustainability report coming out at some point that has a lot of good background, and we have a lot of good resources that are on this call and are part of the collaborative. So I'm still optimistic that we'll be able to accomplish at least part of what we had hoped, and over time expand those funding sources and make this program available to all the people who need it in Colorado, because there are plenty of them. And some of the sources of funding will continue now. A lot of the license holders already have funding, as we found out through the research that Maryland Nonprofits did, that some of the AAAs use some of their Older Americans Act funding. It's not a big chunk that they have available, but they're using that for classes for staff, etc. COA has been successful at receiving funding both in terms of grants and contracts and training fees and that, and other people have some other internal funding and the other operational funding that is being used. So even if we got nothing, the program would continue. We just want to make that available to more people.
Absolutely. I think now is the time for Colorado to show NCOA what sustainability really looks like.
Yeah, and that we're not dropping the ball. I said, I think that would be really sad for prospective participants, and would be disappointing to NCOA and ACL if it was a 3-year effort and one and done. That was never the intention, and it's not ours either.
Well, very good. All right. Well, if there are no other questions or comments, I'm going to move us on the agenda. And our next item is to hear from Meredith Koob with Telegen and update us on some optimistic news.
Thanks, Mary Pat. Sometimes I feel like I don't have the opportunity to share optimistic news all that often, so this is a pleasure. And Connie, I just want to thank you for kind of stepping in my place last month. The time of the meeting has been overlapping with other meetings I have going on, so thank you for doing that last month and talking about the PowerPoint that was distributed through the collaborative. So basically in that PowerPoint, I had mentioned that we were in the process of requesting approval from Medicare to reimburse per completer for organizations that were willing to take on the service agreement with Telegen for completing DSMP for Spanish DSMP participants across Colorado. And at that time, we were requesting $140 per completer in addition to paying the organization's mileage if they were traveling more than 50 miles round trip to deliver those classes. But we needed to change that to a fixed rate contract under Medicare, so we ended up bumping up the per completer amount to $170 per completer, and then eliminating the mileage. And we recognize that's not a direct, it's not an equal reimbursement, but hope that that's some type of benefit to at least recognize mileage, because partners are willing to travel to extended areas in Colorado that don't have diabetes education. So where it stands right now is those service agreements are in the hands of 3 organizations, and I'm speaking with 1 more. So we definitely have a good amount of partners to move forward with that funding, and it's nowhere near the funding that the State Unit on Aging had available in aggregate. Our completer numbers are much lower, but I just felt very strongly that I needed to lobby to get some sort of reimbursement in the hands of partnering organizations for their efforts, especially around this data collection and survey implementation. So 2 organizations are ready to go and sign off, and 1 other organization is still currently reviewing that, but we're moving forward with that. So thank you so much for your patience and time and reviewing that information. I know it's been a little bit complex figuring out the difference between what you're currently operating under with the State Unit on Aging and what our service agreement will look like, but I've just really been impressed with the work that you all are doing across the state, so feel very, very fortunate to partner with you. Are there any questions?
And Meredith, those contracts, agreements, whatever, they're starting fairly quickly, like now, right? This
yeah,
isn't a program that
basically,
starts in yeah.
Basically, our evaluation and our deliverables to Medicare are quarterly, and the contract goes through to 2019. So we're looking at completion numbers by quarter. That can start as early as this quarter. Telegen is doing classes on our own, so we are getting completers currently without the service agreement in place, but just want to be able to bolster that and increase capacity. So yeah, they're starting in the near term.
This is such a great opportunity for us, Meredith. I really appreciate all your dedication and work on this. I know it's a personal and professional priority for you and passion, so it's really awesome. Who are the license holders you're working with right now, or will be in the coming months?
So I'll let any of them that are on the call self-identify if they'd like, and then once the service agreements are complete and signed off on, I'd be glad to share that. Is that fair?
I'm sure
politically correct.
If you're not sure of who's going to work with you, that's fine.
Well, I'll start. Yeah, COET is very excited and vested in participating in this program, and we're finalizing our service agreement next week.
And I think that there's actually 1 organization that's not on the call this morning, but I'll be glad to give an update once those are signed off on.
Can you say, are you just planning to work with 2 at this point, or do you have others that are in the works as well?
I would anticipate 3, and I think amongst those 3 that we'll have a pretty good statewide reach. And like I said, our funding is limited. So we definitely don't have the funding to reimburse a huge number of completers, but my hope is through this painful process of data collection, because I've been on the other side of that and appreciate the effort, is that we really commit, Telegen, when I say we, that Telegen really commits to looking at that data and helping the partners present that in a way that can strengthen grant funding requests, as well as obviously what we're reporting back into Medicare for the benefit of the program, just in thoughts of sustainability. And Kelly, I know that you guys do so much around that too. I don't know if you want to add anything about that. And I think we all recognize the importance of having data that really paints a picture on the impact that we're making. So that's a big goal of mine, is to be able to feed that data back to the organizations in a way that really helps them continue to be sustainable over time.
Yeah, no, nothing other than I totally agree, and we so appreciate your efforts, Meredith, and I'm glad you're on this project.
Oh, thank you.
I don't
know if I've shared with this group. I know, Connie, you mentioned my personal passion, but for those of you that may not be aware, I'm a type 1 diabetic myself, and so this is something that every time I talk about it, I get emotional, because I'm just very committed to getting this education to the people that need it. So I can't thank you all enough.
Mm-hmm.
Thank you.
Meredith, did you, if I'm not prying too much, did you tell me that you had taken the class? Or are you just aware of it, or maybe I have done other things that you know you can do from firsthand to make a difference in diabetes?
So when I was first diagnosed about 19 years ago, I had the most amazing clinical team out of the National Diabetes Center over at Lutheran. So I went through the clinical diabetes education program, and as you know, insurance caps that benefit at a certain amount, and then they kind of handed over my care to my primary care doctor, and then I eventually got an endocrinologist as my primary, who still is today, and they had really never inquired into my thoughts or need for additional diabetes education, and I didn't think to ask. So essentially, when this contract came through with Medicare then for diabetes education, I was allocated to that project under Telegen, and through that opportunity then is when I initially went through the DEEP training out of University of Illinois in Chicago, which is somewhat the equivalent of the Stanford program, just doesn't have the same amount of lengthy evidence base behind it. But once I saw that Stanford was so widely utilized in Colorado, then I took the training to become a leader through Center for African American Health back in December, and was just really impressed about the complement that this class provides to what I receive from a clinical standpoint, especially the group kind of camaraderie and support, and that's something that Jenny mentioned. So the action planning and goal setting has been making a lot of difference for me personally in my diabetes maintenance and control.
That's great. Well, it's a great example of just that these kinds of programs can make a difference in people's lives, as we all know. But it's great to have somebody who's a living testimonial as part of our collaborative. Thank you.
Yeah, and I'm happy to answer any questions.
Stanford's model and initiated that there would be peer leaders. You know, that's that concept that at least one or both of your co-leaders have personal experience with a chronic condition, diabetes, chronic pain, you know, and boy, that makes it so impactful to the class. Thanks, Meredith, for sharing your story.
Yeah, thank you.
Anything else on the Intelligent Project? Anybody? Otherwise, we'll move on. So our last real agenda item is discussion on the name title for CDSME. I know this has been carrying over month to month on our agenda. Connie, do you have any input here or thoughts? Or
I do. I asked twice on the last query to everybody for their input on the most popular name that I got on the query before that. When you may remember, I sent out a list of the names that had been suggested and basically asked people to vote for put them in, rank them in priority order. And based on that, the ones that were at the top of the list were Healthier Living and Healthier Living Colorado. Healthier Living Colorado is COA's. So I sent out the last 2 questions about saying, hey, Healthier Living was at the top of the list. Who supports that? What are your comments, etc. And I didn't hear from everybody even after 2 queries, which was disappointing, but I really appreciate the people who did respond. There were, while I rattle through a couple of papers here, I've got this on speaker because I don't have a headset here, but you get 7 responses. So, and everybody that was on, that weighed in said they would be fine with doing Healthier Living. So as far as statewide outreach with the sustainability, that's what we will be using. I would really like to encourage everybody to adopt this name. I know that some won't, but this is what we'll be using from a state level. The next part of that was taglines, and I got some input on that as well. Haven't tackled that, then there's no consensus on that because this was an initial request for proposals and information on those possibilities for a tagline. But that's important too, because often the other states have used the tagline in their marketing materials, like to participants. There's different ways of doing this with the different audiences, but when you're trying to recruit somebody into the class, a lot of them may use the tagline to try to get some interest, like take charge of your health or take control of your health or that kind of thing, and then identify the program as part of the brochure or whatever it is. For professional audiences, we would be using the name, and then we will be attaching the term chronic disease self-management. Probably in both, I would suggest doing that in the participant materials, but it would definitely be part of the professional outreach that we'd be doing for sustainability, because you know, those audiences use that term chronic disease frequently and are not offended by it because they're in the medical, either in the medical profession or you know, they may not be exactly, but they're not offended by, you know, being identified as someone with a chronic disease. So anyway, I will send out some other information and request for information about taglines, and hopefully we can settle on something like that before too long. I really appreciate everybody's involvement in this, and the people who submitted comments this last go around was helpful. I wish that everybody would rally around and say, you know, definitely this is what this is either definitely what we want, or yes, we will. We wanted something else, but we agreed to do this for the greater good, so to speak. And you know, hopefully we can move to that over time. But again, we did need one name from a state perspective, so we'll be using that.
And the one name is Healthier Living?
Healthier Living, and yeah, well, I guess we need to figure out what we deal with the diabetes classes and all that, but that's my first step.
Okay.
We've talked about it long enough.
Yeah.
And at some point, I just have to say, okay, you know, this is what we're going to do, and I really did give many opportunities for people to comment. And, you know, I hope that the people who didn't comment, I hope that doesn't mean that they don't want to do that. But again, we had to do something. We can't have an outreach presentation to some organization and say, here's our multiple choice list of names. So I understand that people have other names that they may not want to give up, and they'll need to explain to whoever that that's part of this same program. But and that's, you know, that's a choice that can be made at the local level. I can't control that, but you know, I can make decisions about what we'll be doing at the state level. So that's what I've done with this. But it's based on all your input. I would have actually chosen something else. I'm fine with Healthier Living, but I was not pushing for this, so this is definitely not my decision. It's based on the input I got from all of you.
All right. Thank you, Connie, for working on that. I know that was not an easy task.
No.
Sort of like herding cats, I think.
Yeah. And I do have a couple follow-up comments if I could make to things we talked about earlier. Would
Sure.
that be okay?
Yeah.
Excuse me again for the rattling here of papers for just a second. I did look up on Stanford's website, and to your question, Monica, are you still on the line, Monica? Okay, I guess Monica's not online, but for everybody else, there is no training offered by Stanford on the overall CDSMP leader or master trainer training other than what they do in person, and I doubt that I would support paying for that just because of the expense of their tuition and the travel, etc. We did pay for some people to go out of state to other states where the cost was less, and that's a possibility again this coming year if there's a definite need for master trainers that can be justified with, you know, some committed level of support and participation afterward. There are online cross trainings offered through Stanford, which I definitely support. All of our commitment to this in our budget is to pay for half of the cost of whatever the training is, though, so keep that in mind. That's part of requiring that there be some level of commitment at the local level, as demonstrated by supporting financially. So, but anyway, the cross-training through Stanford online is an option. The cross-training through COA is an option. The leader training through COA and through other organizations are also options. All of those are options other than the Stanford in-person training. And again, the commitment is for us to pay for half of those costs. So, for example, if somebody wants to go to COA's leader training and they're not from the Denver metro area and the training is in the Denver metro area, then we could pay half of that cost, which would be like either the tuition or travel reimbursement, and the organization be responsible for the other. There's also free training offered through various license holders over the course of the year, and everybody's been willing to and open to inviting other participants, other license holders, to attend those trainings, typically at no cost. So we would be able to pay for the travel reimbursement for somebody to come into Denver for that if they're not from this area. So lots of opportunities, and again, I'll be reaching out to everybody to say, hey, what are your needs, so we can figure out how to budget for that. I don't know if we have time for this. I'll just throw this out, and I guess we've got another 15 minutes. I'm not looking at this. Or I think you said that this is the last agenda item, but there may be other things that people want to talk about. But anyway, just briefly, I was talking to one of the physicians who is interested in participating on that webinar that I mentioned a little while ago that was through Telegen. That'll be physicians presenting to other physicians to encourage them to adopt the program. And one of the concerns he mentioned was that it's difficult for them to know or find ways for their patients to continue what they have learned and prioritized and adopted as part of the class. So I don't know if we could maybe put that on the agenda, Mary Pat, for a future meeting to say, you know, have people come up with any ideas. It's not part of the Stanford model, with the exception that there is a resource that's available now, the continuing online support community. And then anybody and everybody who's taken a class is more than welcome to join in, and they want as many people as possible to do that. That's funded out of California, and they're hoping it'll be available long term, but most of our folks are probably not candidates for that. So, you know, I know for me, sometimes I'll go to a seminar or training or whatever, and like a lot of people, I suppose, you get all fired up to, this is a great idea, and then you get back home and, you know, kind of lapse into business as usual, whether it's professional or personal. So I think it's a legitimate question. So I don't know if you think that would be something to brainstorm about on another call, Mary Pat?
Yeah, I think that's a great idea. I just jotted it down. I think we'd all be looking for that, because we've run into it before ourselves with different practices or clinics, or even, you know, retirement communities, whoever, who will say, well, now what? You know, they're just getting warmed up after 6 weeks. And what could be some options? I mean, it is about self-management, so Stanford would probably say, you know, this is the skill building part, and then they're just go out and self-manage. But I think it would be great just to do some brainstorming amongst ourselves of some thoughts and ideas, because it has come up before.
Okay, great, thanks. That's it for me.
All right, great. Well, thank you. So our next slide is our regular listing of trainings that are coming up. But before we wrap this up, does anyone else have any other questions in general, agenda items they'd like to see in the future? We're always open to making sure this collaborative meets your needs and is time well spent. I think it is, but want to be sure we don't lose sight of what might be other things that need to be brought in. That's why I suggested the idea of having other you know, resources come in on a regular basis. I think that we could find that really helpful. So if anyone has somebody, they have a best practice or a partner that's really been successful with sustainability and embedding this, would love to add that to some upcoming agendas. I know in October, November, we have some guest speakers coming. Maybe we don't want to add another person, although I'd like to keep this to maybe about a 15-minute exchange. So let's keep that in mind, and I'm more than welcome other suggestions from other license holders. It'd be great if we can all, you know, have somebody, because it'd be great to hear from different areas of our state and different practice examples. So encouraging that. So the slide before you is our
Mary Pat,
somebody has something?
Yeah, I'm Connie again. I have a suggestion, which is Sally Thorson, who works for CDPHE, and she works with the falls prevention. And she it's funny, she's so modest about her successes that I didn't expect to see this long list of organizations she's already worked with. So with the falls prevention, I mean, she's things with recreation centers where they offer the classes and as a regular option, you know, regular opportunity, and you know, people pay the tuition to take the class, and she's done things with other health care organizations, etc. I made an offhand request to see if she'd be willing to do that, and she said she would. So maybe we could see if she could do that for December if you'd like.
Yeah, I'm happy to follow up with her. We work with her too, so whatever. But yeah, that's a great idea.
Yeah,
as Kelly was mentioning earlier, that there's a lot of crossover between whether it's a falls prevention, evidence-based, DPP, you know, chronic disease, lots of things we learn from each other. So she'd be an excellent person to share.
Okay,
I will, if you want, go ahead and follow up with her for December.
Sure.
See if that's something she'd be willing to do. Okay. So there's our trainings coming up. I know Ellen was on the call. Ellen, I don't know if you have any more you want to add to this. But University of Colorado up north has got a training actually starting here in another week or so. And they're doing the CDSMP the 14th through the 17th, and then on the Friday, on the 18th, is the cross-training for the diabetes. So they've got a great class. It's free. So it's the last one I'm aware of this year in 2015, unless anybody else has anything they're posting. But I know Melissa's just finishing one up, and I think that's it for her in Boulder. And Crystal said they probably weren't doing anything else the rest of this year. So I went ahead and posted our January one because it's right around the corner, as we all know. So we will be having one regular 4-day CDSMP and then a 2-day diabetes cross training. So there you have it.
Maybe if it's okay, is Ellen still on the line?
I am.
Great. How would you feel about me sending an email to the collaborative members, since only some of the people are on the line, to offer these, mention these opportunities that you've got going in a couple weeks, and and say that if anyone's interested, I could pay for their travel to attend.
Okay, that'd be great. Actually, we have a couple. COA sent some people to us, so they might be April Basler. I don't know if anybody knows who that was. And then Gail, she goes by, not Gail though, Christy, no. And so she's coming up too. So there are 2 people coming down from Denver to be at the training. So yeah, that would be good. I could email you those 2 people's addresses, or you could give me the information. I can forward it. So let me know.
Well, that's fine. I was thinking of trying to recruit other people that want training and don't have any funding, and
that's fine.
If you're offering it for free and we can cover travel, then it's a great opportunity for them.
It is. And like I said, we're doing it, but the only thing I'm asking for is if they can help pay for the book and the notebooks that we build for them. So it's not quite free, but it's fairly free.
Pretty minimal. What's the cost of that, just so I could mention that?
The books are what, $15, and then like $25, is what we're looking at.
Yeah. Okay. More than reasonable. Okay.
I think so. Thank you.
Sure. Thank you.
Hey, Ellen, did you hear from Ann Sorensen?
Ann Sorensen, I did, but she hasn't written. I sent her all the information. I haven't heard back from her. She's yet another one. So, yeah, we did some initials before we had everything set up, and I sent it out and haven't heard from her. So I'm hoping she'll be able to join us too. So.
Okay. What are your numbers looking like? Class size?
About 10 right now. So.
Perfect.
Yeah. But we can take a few more if need be. So yeah, because 15 is what we max out, but 10 is
What
good.
about is that okay for the cross training? Are you opening that up to?
Yes, we are, but it's a little weird in the sense that we're going to finish up early on the 17th and do a lot of that initial stuff on the 17th, and then the 18th we'll be hitting it hard. So anybody that wants to do the DSMP, they may have to come down a little bit early, a little short day on the 17th and all day on the 18th.
Okay, that's good to know.
Okay, I also made a note to myself, just another plug for the potential of participants to do online classes. I know, again, Connie has some scholarships to do that. So if any of you have participants who aren't able to do an end-user class and an online version would work for them, I just didn't want us to forget that that's available to us. It's not leader training. This is an actual participant class online. So any more on that, Connie, that you might want to?
No, thank you for mentioning that. I mentioned this before, and I think I failed to do this, is that I'll send out the flyer again that, well, actually I have a new one, because this program has been taken over by a
private company, yeah.
Yeah, I remember Canary Health. Anyway, they have some materials that are that they want us to use that are pretty slick, so I can send that new version out to everybody, and it also provides a connection to our flyer, as I recall. So anyway, cool. Yeah, and I'm going to be contacting some other organizations because we need to get moving on filling those classes. Our contract expires the end of February, and we had 50 slots, and I think we still have 50 slots. So I know there's a need out there, and I initially was trying to offer that primarily through our vocational rehabilitation folks that work here and serve people with disabilities, and I'll be trying again, but for whatever reason that hasn't really panned out, which I'm disappointed about. But there are other disability communities, and I will be contacting them, but would love to have people from anywhere and everywhere. And then, Mary Pat, I need to send you a link as well, so you could put that on the website, if that'd be all right.
Oh yeah, that's great. Yeah, we'll make that happen. Okay. All right, so future agenda items, they've both been discussed throughout the meeting. Next meeting, October 1st, Connie has invited a speaker from NCOA who will share about sustainability, and so that's going to be great to get some national models and feedback on next steps for us in doing sustainability. And then our November 5th meeting, once again, this is a guest of Kelly McCracken's Renee Callanan, who will share about the Colorado chronic disease prevalence by age and geography. So I know that was something everyone was kind of interested in, seeing that data and how that might affect our services in implementing classes. And so next meeting, Thursday, October 1st. Was there a comment? Thought I heard something.
I hit my
oh, okay.
I accidentally, not in frustration, I bumped a desk.
Oh, okay.
It wasn't a gavel or anything.
All righty then. Thank you all so much for your time this morning. Again, this meeting has been recorded. It'll be posted on Self Management Colorado along with the minutes. And we just wish you all a happy fall. It's going to get cooler.
Have a happy Labor Day.
Yeah, there you go, Labor Day weekend. Thank you all.
Thanks.
Thank you.
Bye-bye.